welcome to the Business Intercept. I am Kiara Ashanti, and today I'm going to begin a short series now that the Democratic ticket has been established. What we're going to talk about is not politics, not really, because the Business Intercept is a channel that's dedicated to business news and things that affect the economy and businesses. That's my hope. And really what I'm trying to do with this particular channel. But of course, we are in an election year, and the things that either president does or proposes to do has an effect on the economy as a whole and on businesses individually on a much smaller micro level. So what my goal to do as it pertains to Joe Biden and the Kamala Harris ticket is explain in detail exactly what it is that Joe Biden has in his economic plan, what he says he wants to do, and then more importantly, politics aside, what is going to be the actual real world repercussions, good or bad, for me, you, and everybody else. Because at the end of the day, what really matters ultimately is not really how somebody sounds, nice, mean, credible, not credible, but whatever it is that they're deciding to do, what is it, what kind of cost, what kind of effect is it going to have, positive and negative, on our lives and on the business of this country. So this is going to be, like I said, a multi episode feature because his economic plan encompasses quite a few number of things. And when I first tried to record this, it was like 2 hours long. And while certainly somebody might watch 2 or 3 hours worth of a video when it's Joe Rogan, I don't think I've quite got that type of cachet just yet. So we're going to break this down into smaller portions that are easier to watch, easier to digest. The information that I'm pulling this from is from an article in NPR. So you can go to npr.org, I believe is their website, and from Joe Biden's own web page. He's got a lot of different plans that encompasses a lot of different things. But we're going to go through everything step by step. And again, let's just talk about what they happen to be. Okay. So starting off for episode 1 of this particular series, we're going to talk about the big one, healthcare. Joe Biden, and now along with Kamala Harris, and she factors into this in a way that you might not imagine, and we'll get into that in just a moment here. They have a plan. Or Joe has a plan and she's backing it up now. So on healthcare, let's kind of go through exactly what he plans to do, according to him. This is text that I'm going to be reading on my notes here from his website. Okay. So healthcare, Biden has perhaps 2.5 items that are his primary things that he wants to get done. The first, of course, is to revisit Obamacare and expand it back, number one, back to where Trump and the Republicans took it. So obviously, when the Republicans were able to take the Senate, they started to nibble away at the plan when Obama was still president. There was only so much that they could do because ultimately he was the president, right? And he could veto anything. But as Trump came in, they really started taking bite-sized pieces away from the plan. So even though they haven't been able to completely get rid of it, because frankly, John Roberts and the Supreme Court's just not going to, they've essentially, in many ways, been able to render it toothless in a way. Okay, so Biden wants to cancel all of that, get it back to where it was before Donald Trump came into office, and then expand upon that base, make it, in their terms, make it better. Okay. Now, basically, what he wants to do is the following on doing that. He wants to eliminate the 400% income cap on tax credit eligibility. So what this means is this. Obamacare was sold on the idea that it would cost you and I less money, okay, in terms of monthly premiums. Now, the way that they were able to, try and achieve that on the front end was through tax credits. So, let's say that you are a mother, single mother, and you have 2 kids, and you are at the poverty line, okay? Well, I'm not going to say that, because the poverty line is right around, I believe, $21,000 or so, okay? Let's say you make $35,000, okay? So what they would do is calculate a certain percentage of what you would be eligible for under the Obamacare plan for tax credits, and then apply those tax credits directly to your monthly premium. So let's say for your family, your monthly premium was $750, but you qualified for a tax credit of $450. You would only pay $300 a month, thereby making your monthly premium cheaper to you ultimately, because the government is picking up the slack. Right now, the cap on that is 400%. So if you are whatever, take the poverty line, which may be in fact less. The poverty line, let me just look it up real quick here, because that will just make this a little bit easier, so we can look at hard and fast numbers. U.S. poverty line. So, all right, so let's say you have 3 people in your household, single mom, 2 kids, 3 people. The poverty line is $21,720, okay? So the 400% gap essentially is take that $21,000, times that by 4, and if you make up to that amount of money per year, you're eligible for tax credits. Now, obviously, someone who makes the top amount under this, times that by 4, you're looking at right around call it $65,000, $66,000, somewhere around there. So someone who makes $60,000 is getting less of a tax break than, if that woman's making only $25,000 a year, okay? But Joe Biden wants to expand that. So he wants to eliminate that cap, meaning the number of people who would be eligible for that would be a much larger number. So perhaps what he does is turn that $400%, make it 800%. And then for now, in that same scenario, the income cap wouldn't be $65,000 or $66,000. It would be somewhere around, maybe like $110,000 or something around there. Okay, so again, just to use another mathematical example, if your premium is say $1,200 for your large family, but you qualify for $450 in credits each month, then your premium is only going to be $750. Getting rid of that 400% income gap would make again, the number of people who will be eligible for Obamacare and eligible for Obamacare credits much higher. Now, on a political level, this makes sense for the Democrats to want to accomplish, because a lot of people who consider themselves Democrats and liberals are actually high income, and they don't qualify for any of this. So even though someone who makes $150,000, $200,000 or what have you should be able to buy their own health insurance, if they can get government help, they'll take it and be happy about it, and then vote for Democrats in the future to maintain Obamacare, or maybe even expand it to single-payer health insurance, which is what a lot of Democrats ultimately want to happen in the country. Okay. Now, the second thing that Biden wants to do regards to healthcare is lower the age of Medicare eligibility from age 65 to age 60. Now, he says he won't require them. This is key, because this is where Obama made his mistake. He won't require them to go on Medicare, but he wants to make it available to those who want it. So, as I just alluded to here, one of the big mistakes that President Obama made when he created or started pushing for Obamacare was making it mandatory. Meaning, if you had a health care plan that you liked, either private that you pay for yourself out of your own pocket or through your employer, okay, in some form or fashion, you had to go on, if you were in a certain level, you had to go on Obamacare. It was mandated. You had to have insurance, whether you wanted it or not. And again, if you didn't have, if you didn't have health insurance at work, then you had to take an Obamacare plan, period. And you had to take the plan that was set up within Obamacare. You couldn't have a plan that was different from what they put in the law. People don't like being told what to do. I mean, think about right now where everybody, mayors, commissioners, and governors in certain states are telling people to wear a mask everywhere they go. People don't, and many people aren't doing that. And not just because they don't think the government has the authority. Human beings by nature don't like being told what to do arbitrarily. At least a good portion of us don't. So, what Joe Biden is doing here is ostensibly correcting part of that problem by saying, if you want to go on Medicare and you're at age 60 or 61, you can do so, but we're not going to require it of you. Okay? Now, here's the thing. This is kind of a tippy-toe step into Medicare for all. Okay? Which, apart from the title being a misnomer, because Medicare for all would not in fact be Medicare, it's a real small way to try and appease the Bernie Sanders base of the wing and the Elizabeth Warren base of the wing that wants Medicare for all. Okay? So it's kind of middle of a road. I'm not sure how either of these are going to appeal to the Bernie Bros and Bernie sisters, because they want single payer. They're not interested in Obamacare because Obamacare is still administered by private health insurance companies. They're still not. They still don't care about Medicare necessarily, true Medicare, because again, the way Medicare actually works is it only covers a portion of health insurance costs, and the rest you either have to pay for out of your pocket or you have to get an insurance company to cover it. And that's what most people do. They get a Medicare supplement or they get a Medicare Advantage plans, which again is a little bit different than they used to be before Obamacare, but you get something like that to cover the costs that Medicare by itself doesn't take care of. And the person that picks up those costs and whom you pay your premium to is a private health insurance company. And the reality is, look, they don't want private health insurance. And I'm not, in this particular video, debating whether or not that's smart or not. That's a completely different type of video. The issue is, they don't want private insurance. They want you to have the ability to go to a doctor, not pay any premiums, because the government is picking that up. So many people in the country actually don't want that. And a lot of people who don't want that aren't Republicans. So this is a, mishmash, again, tippy-toe, mid-range way of doing something on Medicare, or rather health insurance, that doesn't completely alienate either side of the aisle, or at least that's their calculation. So who are going to be the winners of such a program? If Joe Biden wins the presidency and is able to get this through, who gains? Well, oddly enough, the biggest winners are going to be insurance companies, you would think, And how's that work? Now, say you would think, and I'll explain what I mean by that. Obviously, insurance companies will get a new marketplace. But in reality, it's not going to be as cut and dry as you might think. And here's why. And I'm going to refer back to my notes a little bit here so I can make sure I don't miss anything of importance. Healthy working and seniors will probably remain on their group plans. So if you're 61, 62, and you're still working, you're not likely to go on Medicare necessarily because you already have a health insurance plan and your employer is contributing to it. So you like it better than possibly going on Medicare. And so you don't move. Okay? And they're healthy. However, two things could happen. One, how can I put this? Medicare is a weird thing. And by that I mean this. There are certain things that Medicare will cover actually that in a better way than a Medicare and a Medicare supplement will cover in a better way than group health insurance. But there are certain things group health insurance will cover that Medicare won't. And there are certain things that your group plan will in fact cover, but the combination of your co-pays and co-insurance could be a lot of money. So there are people who have health conditions who are on their group plans that still don't get certain things done because they don't, the co-insurance, the 20%, for instance, I'm sorry, this heat from the lamp keeps making my nose itch, is going to be more expensive. So if you have to do a surgery, and it's going to be, let's say, let's not use surgery. Let's use you're dealing with cancer, and your costs now are up to a lot of money. Your 20% could really add up. So what we could see is two things happening. People who are very sick might decide to move off of their group health care plan and move into Medicare because it might be financially better for them for the conditions that they have to deal with. Now, of course, that's exactly what those in the government or those who are proponents of this would say, well, yeah, that's the way what we want. That's what we're hoping for because it helps these people. But it hurts the insurance companies because they now have a much higher rate of payouts than they had before. You got to understand that the way that all insurance works is not only trying to mitigate risk, but mixing people who are getting claims paid with people who are paying money but don't need any claims paid because either they're not sick if you're talking about health insurance, or they're not getting into accidents if we're talking about automobile insurance, for instance. The more people you have on a plan that are taking out of the plan in claims, the worse it is for the insurance company because they've got to continually pay out money. And you might say, well, so what? They've got plenty of money. Well, the only reason they have plenty of money is because there's a mix. There's a mix of people who are healthy and people who aren't. If the only money that's coming in is from people who are unhealthy and more money is going out for them and there's nothing to counterbalance it, they can't pay those claims. And they have to raise rates. So while it might appear on the front end that a lot of health insurance companies are going to gain from a situation like this, it's not as clear cut as you might think. Because while, a new marketplace for an insurance company or an expanded marketplace for an insurance company is a great thing as long as the expanded cost of that marketplace can be contained. If they're not contained, then look, it becomes an issue. Okay? So, what's the other effect? The other effect is this. Many companies that have employees that remain working to the point where they are eligible for Medicare are forced off of the group health care plan and into Medicare. Essentially, the way it works is they say, If you are eligible for Medicare, you have to take Medicare. You can't be on a group plan. Now, there are a number of reasons that companies do that, the biggest being trying to keep their premium costs for the company and their employees as low as possible. And just from a statistical level, again, from a statistical level, once you hit age 65, the cost of healthcare goes up quite a bit. Not only in terms of the things that you're doing, but just a higher utilization. If you expand Medicare to age 60, I could very easily see companies telling someone who's 62, 63, they must go on Medicare, even if they don't want to. That's not going to make them very happy. But look, that's exactly what could end up happening, and is likely to happen with a lot of companies, including Fortune 500 companies, which you would think have enough money to absorb it. You can see that happening a lot. Now, the best segments that I can think of that would really gain from this change would be the following companies: medical equipment and outpatient surgery centers. Because as new patients come in, they move towards services that are not cheaper under the Medicare rules. So medical equipment through your health insurance at work, your co-pays and everything else is still likely to be more expensive than on Medicare. So someone will use Medicare so that they can get those things. Things like scooters, for instance. Now, granted, there's not a lot of people who have a lot of jobs working that are using scooters to go into work. Typically, if you're using a scooter, you're either retired or you have a disability. And so you're getting disability insurance. But I'm just using that as an example. Many of these motorized scooters, Medicare will actually pay for because it's medically necessary. If you expand out to 60, a lot more people who aren't getting these things now will be able to get them. And there are other types of equipment as well that you could see the same thing happen. So medical equipment companies could see an increase in sales and revenue because there's more utilization of those particular things. Okay, outpatient surgery is the same thing. Even though many private insurance plans through employers have a cap, and the same thing for private, very often though that 20% still could be $3,000, $4,000, $5,000. If you're paying for your own health insurance, it can be much higher because you're trying to keep your rates much lower. And even under Obamacare in its current incarnation, that co-payment or co-insurance could end up being a lot more than if you were under Medicare. So the practical reality is there are outpatient surgeries that might not be medically necessary in terms of life or death that are still necessary that people have been putting off. When they go on Medicare, it's covered, and now utilization of those outpatient services will go higher. So outpatient surgery centers could again see a much higher increase in their revenues as well. So from a business point of view, as an individual, this is where you got to look at. Medical device companies, the ones that are publicly traded, might become good investments. If you're a high net worth individual and have the ability to invest in real estate investment trusts, which very often carry properties for not only commercial office space, but a lot of medical companies and outpatient centers in their portfolio, they could be better investments for you going forward. If you're so fortunate as to be able to invest directly in a physician's group or in a company that specializes in building these surgical centers and maintaining them or what have you, that too could be an area of greater investment for you because they're going to be utilized in a much greater way. Okay. Now, unspoken about all this, and we're going to talk about this in segment 2, in part 2. You can't expand any of these services without getting increased tax revenue. Okay. Currently, right now, the number of baby boomers that are turning age 65 year to year is astronomical. Because, of course, the whole point of baby boomers is that segment of the population, there's a lot of them. That's why they're called the baby boomers. Okay? So, that's year to year. If you automatically expand out, okay, from age 65 to age 60, you're increasing the number of people who now can be on Medicare exponentially. I mean, right now, the number of people that go up, let's say it's this much every year. You go from, you make it to age 60, it's like this. Okay. That's a lot of increased cost to the government in terms of outlay. All right. If you simultaneously, okay, expand Obamacare, where there are a lot more people who can get direct payments in terms of tax credits that cover their a portion of the premiums, you're also expanding expenses on that side. Okay, that means tax revenue has to go up. Now, notice I said tax revenue and not tax rates. Okay, because in part 2, we're going to talk about what Joe Biden wants to do with taxes specifically. But understand, just as a precursor to that particular video, tax rates is not the same thing as tax revenue. Okay? And we're going to get into that in the next segment in a little bit more in depth. But again, as a precursor, understand that by doing this move, the government will have no choice but to try and get more tax dollars in to cover the added expenses that are going to go out. Now, to end this particular segment, here's something to think about. What are the Bernie people going to do? Because the government sending billions of dollars to insurance companies is not exactly what they're down for. They have no interest in that whatsoever. Okay. So will they, will many of them stay with Biden? I don't know. I mean, he's certainly a lot more likable than Hillary Clinton was. So the idea that a lot of the Bernie bros and Bernie sisters who could not stand Clinton and didn't like how the Clintons treated the Bernie wing of the party at the conventions might decide to either stay home or switch to Trump, which a lot of them did. I don't know how much of that will happen this time around because, again, Joe Biden, for all of his faults, is a hell of a lot more likable than Hillary Clinton ever was, will ever will be. Okay, but they're still getting dissed to a certain degree in terms of their agenda from a socialist point of view. And so how that will all turn out in the election will also be an interesting thing to see. Now, if you have any questions about what I kind of reviewed, or if you have a personal situation yourself that you don't mind sharing and you want to figure out how would either of these two situations affect me specifically, please put that down below in the comments and I'll answer that question. As I've mentioned in many of my other videos thus far on this channel, I spent 25 years in the financial field. I've been an insurance agent. I understand health insurance and all forms of insurance in a way that most people don't. More importantly, I'm one of those crazy people that 8 years ago actually sat down and read every single page of the Obamacare plan. Because I don't have a life, so I decided to read it. So I understand that better than a lot of the people who are out campaigning for it right now. And so I can answer a lot of the questions in a much more detailed way than most people that you might see on YouTube or that might talk to. So please put those comments or questions down below. Hit the subscribe button and hit the notification bell so that you know when the next videos that talk about Joe Biden's economic plans are posted, you'll find out about them.